Hello, I'm Lee Barrett. I'm Executive Director and CEO for the Electronic Healthcare Network Accreditation Commission. What we want to do today is to talk to you about a new program that we have announced and launched in conjunction with both ENAC and UDAP.org. And we announced this program on January 1st, 2021, which is the Trusted Dynamic Registration and Authentication Accreditation Program, or commonly referred to as TDRAAP. As part of the 21st Century Cures and the promotion of interoperability of health-related data, this program combines the requirements of privacy and security with the development of technical best practices related to trusted app registration and user or system authentication. Today, I'm joined by one of ENAC's senior reviewers and practitioners, Leslie Berkeyheiser, who's been on the development team for this product. She's here to provide some more details. Leslie, can you tell us about what the program options are available?
Sure. Well, thank you, Lee. You started by telling our audience that this new program combines the requirements of privacy and security, something that ENAC has been doing for over 26 years now, accrediting organizations, with a technical framework and best practice. That's UDAP, the Unified Data Access Profiles. And these are related to trusted app registration and user system authentication processes. So we have one program, TDRAAP, and it combines those two things, privacy security with UDAP technical framework. And then it provides for two different options, basic and comprehensive. Now, organizations promoting consumer-facing APIs or application programming interfaces using the UDAP and authorization code flows can gain TDRAAP basic certification. This allows them to share with others that they can be trusted when they're being authorized to health data under patient access rules. For example, when a patient's using their own credentials. That's a good example. This is a certification program. It's valid for 1 full year. It combines privacy and security self-attestations with the technical testing. The cost of this program is $1,200. That's basic. The TDRAAP comprehensive program is just like all the rest of the ENAC accreditation programs in that it offers full accreditation in privacy and security. This means a reviewer is conducting an in-depth assessment of the organization and their responses, and the participant undergoes more extensive UDAP testing. And this can support best practices all the way through to the 5th star level of UDAP registration and authentication workflows. Now, that's according to the star levels glide path document, which we'll show you soon.
So Leslie, before you get into the stars, you keep using the words UDAP. What exactly are you talking about when you're using that acronym?
Well, Lee, here's where it gets just a bit more technical. Today's most common FHIR data access workflows and our current rules, regarding the ONC and CMS patient access rules are based on OAuth 2.0 authentication requirements. That's where a client application's client ID and a secret or password are combined together, and they're obtained really from a one-off registration process. Now, the challenge with this type of registration and authentication is it's got to be done one at a time. It's kind of clunky when you think about how we have to move through to interoperability. In our future world of healthcare data interoperability, we need all these behind-the-scenes endpoints that might be APIs and servers and others to be able to share important data so that we can have secure, quick, and efficient transfer of information. That's where this UDAP or Unified Data Access Profile comes in. So for added security and scalability benefits, there are more and more organizations using the Unified Data Access Profiles for registration, authentication, and identity-related workflows. Now, these are open standards, and they're really extensions or add-ons to OAuth and OpenID. They're published by UDAP.org, UDAP.org, to increase confidence in open API transactions through use of trusted identities and verified attributes. So UDAP workflows allow for key use cases in the deployment of reusable identities, including the trusted dynamic client registration and tiered OAuth through the use of digital certificates.
So Leslie, that all sounds great, but how do we know it really works?
Well, first of all, UDAP profiles have now been tested at several of the HL7 FHIR Connectathons. They've been part of the Office of the National Coordinator's Fast Security and Identity Solutions. They've been discussed in tracks at the Office National Coordinator meetings. Ongoing continuous feedback comes into the UDAP.org organization via their community participants, as well as other broader FIRE community participants. You also can see evidence of use of UDAP now in the Karen, Da Vinci, and Care Quality FIRE implementation guides. In fact, this slide that we're looking at right now is a slide from a deck from the Office of the National Coordinator in the fall of 2020, where you can see the use of UDAP Trusted Dynamic Client Registration, for example, is showcased. In fact, I should probably tell you a little bit more about how it all fits together. I've been talking about these stars. We've transitioned now to this document you see called TDRAP Glide Path, Authentication Levels, and this is really for the industry. So along with the TDRAP program, both ENAC and UDAP.org have put together this star levels glide path. It's so that a consistent methodology can be followed across our industry as we collectively move from using that base OAuth 2.0, that client ID and secret, and move on to a much more scalable and efficient framework that allows for reusable client application, server, identity provider, and end user credentials. And you can see we've got star levels from 1 to 5. Obviously, OAuth 2.0 is the basic right now as built into our rules. We're proposing to the organization that they move through to gain level 5 in the end to really promote the simplest scaling and the most cost savings for clients, servers, and patients. Attaining a star level shows others with transparency the specific UDAP workflows in which a participant's ready to exchange with others. This improves interoperability, reduces friction, preserves privacy, and increases transaction security confidence. Leah, I'd encourage people to go out to the ENAC.org or the UDAP.org websites to learn more.
Terrific. That was a great overview, Leslie. Thanks very much. So again, please do avail yourselves. Go to our TDRAP information, and you can either look at not only the information that's out there on TDRAP, but you can also schedule a webinar presentation or join our referral partner program. And again, you can contact us at enac.org. Thank you for your attention.